Hello, I am Dr. Prabha Agrawal, Senior Consultant Gynecologist and Laparoscopic Surgeon at Care Hospitals, Hi-Tech City, Hyderabad. Today we will be discussing about breast cancer screening and awareness. So why exactly we are talking on this topic? Because breast cancer, nearly 1 in 8 of women suffer from breast cancer in India, and it is a huge burden on the healthcare industry. Nearly 60% of the patients diagnosed with breast cancer are already in the advanced stage where we are not much helpful to them. But when we diagnose them early, it can save lives, and nearly 70% of the women, they don't have any risk factors. So they are normal women, they come for a checkup and they are found to have a breast cancer. So the early detection is very important in these conditions. What exactly puts you in a higher risk for having a breast cancer? So the people who are smokers, who take more of alcohol, they are not breastfeeding the baby, they are having pregnancy at an advanced age, those who are not at all having children, in those patients the hormone estrogen level is little higher, because pregnancy and breastfeeding gives us a very good hormonal support of progesterone hormone, which puts us as a decreased risk factor for getting breast cancer. So more of estrogen hormone in our body puts us in a higher risk for getting a breast cancer in our lives. So how do we protect ourselves from getting a breast cancer? By decreasing the estrogen hormone load in our body, properly breastfeeding the baby, as WHO recommends. Nearly 4 months of exclusive breastfeeding is very important for the baby and for your own self health. So try to encourage people to do more and more of breastfeeding to the baby. Decrease your smoking and decrease your alcohol. Decrease your processed and canned foods, because canned foods have lot of bisphenols which cause breast cancer in our body. Decrease your processed foods. Decrease your plastics usage in the body, because whenever we heat the plastics, we carry food in a containers, plastic containers, we microwave the containers. So whenever we heat the plastic, there are a lot of PVC chemicals forming in our body which can cause cancers. So try to use more of steel containers, glass or ceramic containers, and decrease your plastic use. Decrease your processed foods, decrease your empty calories, decrease meat and dairy products coming from people used to give hormonal injections to make the meat more and more fatter. So try to decrease those things, and decrease the use of padded bra, the wired bras, and especially in the night time you should give enough rest to the body by removing these clothes. So how to diagnose this disease early? You can diagnose it at home by doing a self breast examination, which you have to do monthly, every month after your menstrual cycle. Just with the 4 fingers of your tip, you should palpate your breast against the chest wall and see if you have any new lump arriving there, any pain, any swelling. Feel for your nipples, any change in the size and shape of the breast, change in the color of nipples, any watery discharge or any greenish discharge coming from the nipples, any puckering or inverting of the nipples or puckering of the skin. You should feel for the changes. When you do a self breast examination every month, any small change also, you will notice it immediately, and you are the person who can diagnose the disease early. And once you have noticed any change, you should immediately consult your doctor, who will do a physician examination. So the screening guidelines in India, after the age of 20 years, you should be doing a self breast examination every month, followed by a physician examination every 3 yearly. And once you cross the age of 40 years, you can follow it up with a 3 yearly mammogram, wherein the X-ray, by X-ray or radiation, they check for any lumps or any changes in your breast. 3 yearly mammogram is enough for you, but for patients who are in the high risk category, like those who have a family history of breast cancer or ovarian cancer or BRCA gene positive, we advise them to go for a yearly mammogram as well. So the annual screening program you should be following with a self breast examination, a physician examination, followed by a mammogram if needed. And by this means you can notice the very early signs and symptoms in changes in your breast, and you will be able to protect yourself and your family members. Thank you.